I don't think the numbers are necessarily going up. I think it's a silent epidemic. I think we've been so obsessed with the, quote, opioid crisis that we really miss this cry for help from patients with chronic musculoskeletal or non-malignant pain and malignant pain. About almost up to 50% of patients with chronic pain have suicidal thoughts. They may not act on it, but one study showed that if you had chronic pain, you were 50% more likely to end your life by suicide than if you didn't have pain in the general population. The figures are even more staggering for people who have substance use disorders. If someone has an alcohol use disorder, they're 10 times more likely than the general population to end their life by suicide. If they have an injection use disorder, they're 14 times more likely to end their life by suicide. So patients who have chronic pain and like an opioid use disorder are particularly vulnerable to self-harm. I think we're so focused on the opiates and the opiates are good, opiates are bad debate and political debate that, again, we just sort of don't see this cry for help. I think that I really try to tell practitioners that when you have patients that have chronic pain, they typically have comorbidities, depression, anxiety, sleep disturbance, all of which increases the risk for suicidal ideation. So aggressively treating these comorbidities are going to do two things. One, they're going to opioid spare, because we know that when people get restorative sleep, it actually improves their pain tolerance, also decreases inflammation in their body, and also improves their mood. If we aggressively treat their depression, their anxiety, then you're going to sort of see a decrease in the opioid demands, but you're also going to mitigate the risk of suicide.